One of the most effective rhetorical moves in NMN marketing is the dose comparison. NMN protocols typically call for 250 to 500 milligrams per day. Therapeutic niacin dosing ranges from 500 milligrams to 3 grams daily. To the consumer who associates lower doses with greater potency, a reasonable intuition from the pharmaceutical world, where highly targeted drugs are measured in micrograms, this looks like evidence of NMN superiority. If a little goes a long way, the thinking goes, it must be doing something more efficiently. That intuition, in this particular context, is wrong, and understanding why requires a short detour into basic biochemistry. Enzyme-catalyzed reactions don't work like light switches. They work like pipelines with multiple valves. The rate at which a substrate moves through a biochemical pathway is determined not just by how much substrate you introduce, but by the capacity of every enzymatic step along the way. When you introduce more substrate than the bottleneck enzymes can process, the excess backs up or gets cleared through alternative routes. Niacin's higher therapeutic doses reflect the fact that a substantial portion of it gets metabolized and excreted before reaching the specific enzymatic steps that produce NAD+. You need to introduce more substrate to achieve saturation of the productive pathway. This is basic pharmacokinetics. It says nothing about relative potency. It reflects the biological reality of how niacin is handled between ingestion and NAD+ synthesis. NMN's lower doses, conversely, don't necessarily mean it's achieving equivalent or superior NAD+ elevation with less material. They may simply reflect a different set of limitations in its conversion pathway, including the significant degradation that occurs in the gut before absorption, the conversion to nicotinamide in many tissues, and the fact that the human trials establishing NMN protocols are short-term studies with no long-term dose optimization behind them. Niacin's dosing has been refined over 80 years of clinical use. NMN's dosing reflects a few years of small pilot studies. The comparison is not between a refined and unrefined product, it's between a thoroughly characterized compound and one still in the early stages of human investigation. Titration is the practical cornerstone of niacin's dosing strategy, and it matters enormously for both efficacy and tolerability. Starting at 50 to 100 milligrams and increasing by 50 to 100 milligrams every 1 to 2 weeks allows the body to adapt, minimizes flush intensity, and helps identify each individual's effective dose without overshoot. Individual NAD+ synthesis capacity varies based on age, genetics, baseline nutritional status, and concurrent medications. Meaning the right dose for a 35-year-old with no metabolic concerns is likely different from the right dose for a 65-year-old managing insulin resistance. One-size-fits-all dosing is a simplification that the evidence doesn't support for either compound. There's also an interesting experimental dimension worth exploring: pulsed dosing versus daily moderate dosing. Some researchers have speculated that larger, less frequent doses might produce different metabolic signaling than steady daily supplementation, potentially through transient pathway saturation that stimulates compensatory upregulation of NAD+ synthesis enzymes. This hasn't been thoroughly tested in humans, but it's a mechanistically plausible idea that applies equally to niacin and NMN. The broader point is that dose strategy is as important as compound selection, and the assumption that lower doses automatically signal superiority fundamentally misunderstands the biochemistry involved.